Well, hi, good evening, and thank you for joining us, and welcome to our webinar that we're going to give on Mast Cell Activation Syndrome, which is something that I am finding is coming up more and more often in my patients. And so I want to welcome Dr. Julianna Dudas, we could call her Dr. Jules. And Dr. Jules has joined us at Restore Medicine. We are thrilled to have her. And she will tell you a little bit more about her background, but Mast Cell Activation Syndrome is definitely, or MCAS, we'll abbreviate it for the purposes of tonight, is definitely one of her areas of interest, amongst others. She works with tick-borne illness, she works with Morgellons, she works with PANS and PANDAS. She's got a range of different strengths and specialties that she brings, and a wonderful background with yoga and very cool things too. So I'll hand over to her in just a second. So just by way of introduction, for you, those of you that don't know me, my name's Dr. Nicola Ducharme. I'm a Lyme literate naturopathic doctor and owner and medical director of Restore Medicine. We're based in San Diego, and we work with people nationally and actually all over the world with chronic complex illness. So with that, I'm going to hand over to Dr. Jules, and she can introduce herself, tell you a little bit more about herself, and then we will be on to our presentation. Just to give you a little bit of a roadmap, we're going to aim to keep the presentation part for about 30 minutes. It's hard to see chat and questions, especially for her with a PowerPoint. So we'll do some Q&A at the end. So if you have questions, pop them in the chat box or the Q&A area, and we will definitely come back to that and answer as many of those as we can. So with that, I hand over to Dr. Jules.
Thank you, Dr. Nicola. So yes, I am Dr. Jules, and I'm super excited to be working at Restore. Complex chronic illness is my jam. So my background is that I initially wanted to work in something that was related to genetics, DNA science, biotech, and I started out there. Then I decided that I actually wanted to work in the entertainment industry. So my first career is actually, I did work in New York and Los Angeles, which is where I got involved with mind-body medicine, because as I was pursuing work in the entertainment industry, I also ended up teaching yoga and meditation, which led me to working with cohort studies at UCLA's Semel Institute for neuroscience, and then working with all of the doctors, postdocs, and that whole system there. I got reinterested in medicine, which led me to then pursue a degree in naturopathic medicine here in San Diego. And during the course of my study in med school, I took a real interest in complex chronic illness, mostly because some of the things that I had been dealing with in my own medical journey and the things that I was seeing come up again and again and again with the patients that I had with my rotations were it was all falling under that umbrella. And mast cell activation was something that I got extremely interested in when I discovered histamine intolerance. And it's a fascinating whole constellation of things, and we're going to get into it. But I've kind of become a nerd on MCAS in the last couple of years and have started treating patients with MCAS, and it's a real passion of mine. So let's dive into the presentation. Let's see, I'll go to... I'm just figuring out the share screen thing here, so. All right. You can see that, Dr. Nicola?
That's perfect. Yep.
Okay, great. All right. So let's start out with what is a mast cell. So these things called mast cells they're little cells. They're in your blood. They're everywhere in your body, actually. And they are produced like other cells from your bones. But essentially, they are immune cells. And I like to call them the sentinel cells, which is like that person, that was part of the army that would stand up on the hill with the horn. And when the invaders were coming in, they would blow that horn to call the troops in. So there are thousands of mediators that these mast cells release, thousands of signals that they have that sort of start immune cascades in the body. And a lot of it has to do with vasoactive substances, which means that it's bringing in inflammation through, like vasodilation. So like this is when you're seeing like the hives come up on your skin. It can also happen in the gut. It can also happen in the bladder. But basically it's when you get like incredibly irritated as if in an allergic response. And they are actually involved in allergic response. And eosinophils and basophils, those are just words for other kinds of blood cells as well, immune cells. And they're also involved in some of these inflammatory and more allergic kinds of reactions. So this is all part of the body's way of protecting itself from danger, from invaders. So Mast cell activation syndrome, we like to say it's when the mast cells are misbehaving, but I like to think of it as more they're overreacting or they're reacting to something and they're not turning off. So they are activated. These are activated immune cascades. It's when your cells are saying danger and it's happening repeatedly and it becomes a chronic situation. And this is when we have this inflammation as a result of these cells saying and crying, danger, danger, calling the troops. And like I said, that membrane permeability is something that these cells are very much involved with. And so what that means is that the blood-brain barrier, this membrane permeability opens wide up. This is when you start to get things like this brain fog and the cognitive dysfunction, headaches, these neurological symptoms like that. As you can see, there's this whole constellation here. So, people with MCAS can also have these respiratory symptoms, GI symptoms we're seeing a lot of, and it can look a lot like IBS or IBD. We are also seeing a lot of like actual bone pain, musculoskeletal pain that's related to the mast cells, which can also be neurologically related too, with the nerve endings being irritated by these mast cells. You'll see flushing and hives and sometimes rashes and other like small things that pop up in the skin. And then there's also a whole range of cardiovascular symptoms. And I'll talk a little bit more about that and sort of the dysregulation that can happen, especially with some of the cardiovascular stuff. And something that's also very common is gynecological, meaning you just have really intense menstrual symptoms as well as urinary. So that's your bladder irritability, something that looks like interstitial cystitis, but actually isn't, like you're testing negative on a urine test. And then, of course, there's actual anaphylaxis, which can be as a result of mast cell activation syndrome that's keyed up pretty high. I'm not going to dwell on root causes here too much because this is the slide with the big long list. But as you can see, there is a lot of triggers. There are some genetic components. There's this KIT gene. There's also genes that are associated with plasminogen, which is part of your blood clotting. And I'll talk a little bit more about that when we talk about biofilms. And then there's something called POTS, which is postural orthostatic tachycardic syndrome. And this is very, very associated with MCAS, as well as EDS, Ehlers-Danlos syndrome. And this is kind of this trifecta that we do see a lot. Patients that have one will have another. They just go hand in hand. We're seeing a lot of mold and mycotoxin exposure as the root cause. Your viral, fungal, parasitic pathogens, including COVID, H. pylori sometimes. You can have hormonal imbalance, and that's kind of a cyclical thing. It can be a little bit of chicken egg because with this complex chronic illness, your hormones get imbalanced and vice versa. Vaccination can trigger it. Environmental exposures, we've got a lot of chemicals out there in our soil, in our air, in our food. Stress. And I say keeping the lights on. When we're under stress, our body releases signals that are like, keep going, keep fighting, stay up, stay awake, you need to be alert. And sometimes the light switch just gets turned on so many times that it kind of gets stuck on in this MCAS picture. And then vagal dysregulation, That's the vagus nerve, which I'm going to talk a little bit more about, and also trauma, which can be intergenerational and epigenetic. And I put under here structural for the vagal. Sometimes there can actually be things that, somebody who's doing physical medicine can work on that can release the vagus nerve, which has a lot to do with so much of what's going on in the body. The vagus nerve innervates everything from your breathing down into your digestion and even up into your talking. So I put here 7 breath reset. And with my background in yoga and meditation, just to kind of get us all here on the same page before we dive forward into the treatments and talking more about MCAS, I'd like to do a little exercise, and it's just 7 breaths. And this is going to be a complete vagal reset, meaning we're going to reset ourselves into the parasympathetic response. So getting out of the fight or flight, that danger, and into that rest and digest. So we're going to do 7 breaths, and all 7 breaths are going to be the same. If you'll follow along with me, we're going to breathe 4 counts into the nose. We're just going to hold for a moment at the top, and then we're going to do 6 counts out through the mouth. And when you come out through the mouth, you can kind of just like blow out like you've got like a boba straw. And then we're going to do a little bit of movement with this, okay? So I want everybody to have their feet on the floor, or if you're laying back, just be comfortable straight back. And you can close your eyes if you'd like, or you can keep them open. And just have your hands relaxed on your thighs. So we're going to start with 4 breaths in, holding at the top, 6 breaths out through the mouth. And I meant beats, not breaths. So 4 beats in through the nose, holding at the top, 6 beats out through the mouth. Now do this again. And I want you to turn your head all the way to the right and turn your eyes as far back to the right as you can. As you're still inhaling, hold at the top. Now exhale out through the mouth. Coming back to the center. Now inhale again through the nose. Turn all the way to the left this time. Make your eyes go all the way as far to the left as you can. Keep inhaling a little bit more, hold at the top. And then slowly come back to the center as you exhale for 6 counts. Now inhale again through the nose for 4 counts. And as you're doing that, I want you to massage right here on your neck. Hold that breath at the top. Exhale out through the mouth for 6. And one last time like that. 4 in, hold at the top. Exhale out through the mouth for 6. And just release your hands down. All right, so you might feel like yawning. You might feel slightly different. That is what we call a vagal reset, a state change. So I use this with patients sometimes when they're exhibiting hypertension, or I can tell that they're just kind of in an activated or a sympathetic kind of nervous response. So now that we're all on the same page with that, testing for MCAS. So this is a tricky subject because the tests that exist are not the best. So people often ask, what do I tell my normal doctors, because they've never heard of MCAS. So there are immunologists and hematologists who are catching up with mast cell and this whole umbrella of symptoms. But it is complex chronic illness. And in a lot of ways, our medical system does not, as it is now, does not necessarily support a treatment that is necessary for something like this. Because this isn't microwave medicine. This is something that's going to be, we're going to be seeing improvement over several months, and we're going to have to try out a range of treatments. So it's something that takes time. It's not like you can take one drug necessarily and everything goes away. But there are diagnostic criteria for MCAS. So with these tests, and these are listed at the bottom of this slide, there's several options for what you can get. The only thing is there's caveats. So the diagnostic criteria has three parts. Number one, you get a positive test from this list of tests. So that's your data there. Number two, you have a positive response to a medicine that's mediating, right? So it's supposed to help a mast cell response, right? And number three, there is a multi-system symptom presentation. So if you go back to that picture before where you see all the symptoms, if somebody has a GI symptom, a skin symptom, and a neurological symptom, that's going to be multi-system. So the testing options, these can be ordered through a lab like LabCorp or Quest, and they can be done through insurance if your insurance will cover it. The only thing is that, for example, with the tryptase and histamine, they have to be done when you're in a symptom flare. Otherwise, they're going to be negative because histamine gets released by the mast cells when they're having a response. So if you're somebody who has hives, you need to wait or give yourself a big trigger so that you're in the hives, then have your blood drawn. And for the tryptase, it has to be 4 hours after that so that the tryptase can then be, because that's something that's also released in response to the histamine. So you see this can get complicated with the timing. And then these other tests can be done as urine. Mostly they're done that way, they're urine markers. But the problem with that is that the urine has to be collected and it has to be chilled and it has to stay chilled. And a lot of them have to be done over a 24-hour collection. And you have to chill each sample before you put it into the big barrel that's collecting. So the tests get a little bit complicated. So if you do have a positive response to a mediating medicine, along with having a multi-system presentation, for all intents and purposes, that meets the criteria for MCAS. But if you do have one of these or a couple of these tests that come back positive, you can then take that to your immunologist or your hematologist who might have some drug recommendations that are beyond what someone like Dr. Nicola or I might be prescribing. Okay, so I've mentioned histamine. So histamine is something that is dumped out by mast cells. And I put in here cystitis because in the EU, so in Europe, they will not even diagnose interstitial cystitis without doing a biopsy of somebody's bladder tissue first, and then staining it. So it's called CD117 staining to see if there are actually mast cells that are activated, that are present in the bladder. So that's kind of interesting. So there's also histamine intolerance. And this is when our pathways are really backed up, usually, our clearance pathways. So we have histamine coming in and histamine going out. Where is it coming in? A lot of times people will be eating foods that are either high in histamine themselves, the foods, or they're histamine releasing. So there's many resources that are available on the internet, but a lot of the main histamine known foods that we know are things like leftovers. Older seafood is very high in histamine. Things like tomatoes or sun-dried tomatoes. Some people have a real big histamine reaction to things like avocados or eggplant. And the thing is with the histamine diet, some people who have MCAS, some of the high histamine foods, they don't react to at all, and others they really react to. So I think it's on a patient-by-patient basis. So that's coming in. We can control what's coming in, right, in terms of what helps with histamine or activates histamine. And then we can also support what's going out. So there are 3 clearance pathways. And not to get too scientific here, but there are 3 clearance pathways for histamine. And those are the DAO pathway, the MAO pathway, and then something called the HNMT pathway. You don't need to know all that. But there are things that you can take that support these pathways, support these detoxes of extra histamine, excess histamine that's getting released by activated mast cells in the body. And these include things like vitamin B6, magnesium, vitamin C, molybdenum. SAMe is really important for that HNMT pathway. Again, you have magnesium multiple times, your B vitamins, and things like copper. Some people, though, and this is a little clinical pearl, some people have a real hard time taking the methylated B vitamins when they're in an MCAS situation because those actually can trigger sort of this brain fog hangover thing with the neuroinflammation. They don't need those extra methylated Bs. So this is something that also we'll have to figure out on a patient by patient basis. We can also do some testing to see how you are actually going through your detox and methylation pathways. Okay. So many symptoms, like we talked about, but the good news is there are many solutions here as well. So I always say with naturopathic medicine, we have to start with the basics. So we're talking about making sure your air, your water, your food, which we already kind of talked about, is really great. And there are some excellent water filters out there. I recommend Berkey, or sort of the knockoff of Berkey. It's called Pro One. Those are excellent and they're not that expensive. If you are in a mold or environmentally ill environment, you have to get out of that. So that's removing yourself from whatever is making you sick, if possible. And then sleep is so important for detoxing. And then also getting sunshine as you can, or, sometimes you can do UV light exposure if you're in, much north, real far north or south latitude. Some people do have salicylate, sulfate, oxalate sensitivity, and this can also be part of the mast cell picture. So it's important for us to recognize whether or not that's something that the patient is also dealing with. Okay, so one of the fundamentals is also just starting with the gut. This is easy. We start with making sure that we're not having too many of those histamine reacting kind of foods, right? Especially with people who are having GI symptoms, we need to address making sure that they're having regular bowel movements. We need to carry toxins out. We need to carry the stuff that's triggering out. We also have to make sure that we have a microbiome that is really balanced. And these are just some of the species that have actually been shown in research to really help with mast cell stabilization, actually. And we've all probably heard of leaky gut, which can happen when our gut gets compromised. We can also end up with that leaky brain, like I talked about, which is something that happens in MCAS. And both of these can be related to these pesky mycotoxins that keeps coming up. Depuration is basically just let's open up detox pathways. One of the main ways that we can detox things that might be triggering MCAS is by sweating. The skin is this huge organ that we have. I really like to use Epsom salts or magnesium flake baths. Magnesium can be more beneficial for people if they're sensitive to the sulfur stuff that's in the Epsom salts. You can also use castor oil packs. And if you don't have a bathtub, you can take a hot shower, maybe go to warm yoga. You want to just get a little bit of a sweat on. And especially for more sensitive patients, start low, start slow, just make it a little bit of a misty sweat. A lot of our patients with MCAS are finding that they actually don't sweat. And that's part of what's going on, is that they need to be able to open that up to start detoxing. Sauna can also be really helpful, red light therapy. And I put here Undas and Percana. These are very, very gentle, more homeopathic based drainage kits that you can get that really start to open up the drainage through the liver, drainage through the kidneys. Okay, we do have pharmacological options, and these are things that Nicola and I and other practitioners can use. You've got your good old H1 and H2 blockers. Those are, that H stands for histamine, and the 1 and 2 are different kinds of histamine receptors in the body. So these are things like your hydroxyzine, cetrizine. You can get that at any drugstore. Those are really helpful for when there's kind of like a brain or neurological involvement, as well as some of the skin symptoms. And then you've got your H2 blockers like famotidine. Those are great if you've got like GI symptoms, some of your more urinary symptoms. Cromolyn sodium can be incredibly helpful for stabilizing mast cells, especially when it's that GI and urinary kind of picture. Ketotifen, leukotriene inhibitors, and then also certain doctors might want to address sort of the glutamate, which is another sort of neuroinflammatory, but it can go along a lot with histamine in the brain. And those might be things a little bit more along the lines of like your benzodiazepines, but I would work with a doctor who specializes in some of that for some of those drugs. One thing that we can prescribe is low-dose naltrexone, and I love using low-dose naltrexone, especially for anyone who's dealing with autoimmune or any of these sort of like complex chronic inflammatory pictures. It's extremely useful for modulating inflammatory response because of how it helps with some of those inflammatory cascades. We also have our nutraceuticals. The first two that I put on here are kind of a little bit more novel in the realm of MCAS. So oxytocin, that is the love hormone. It has no side effects that we know of, and it has shown great efficacy for limbic safety and vagal re-regulation. So a lot of times what happens, and I said I'd talk about the limbic system. So the limbic system is basically, it's this part of your brain. You could kind of call it like almost the reptilian brain. It's the brain that we cannot consciously control, right? But it's the brain that's involved with whether or not your body feels like it's in a safe space or not. Oxytocin can communicate with the limbic system to say, we're safe now, things are safe. And oftentimes people who have MCAS have a turned on, keyed up, I'm in danger, limbic system response that's happening constantly. So oxytocin can help to bring that down. And we can use it as a nasal spray, which is really cool because the olfactory nerve is connected directly with that limbic system, and it's also very close to the vagal nerve as well. Oxytocin is a neuropeptide, so peptides can be very helpful, especially with some of the signaling that kind of gets disrupted with MCAS, and that includes things like hunger and when the body is doing what, whether it's time to rest and digest or not. Glutathione is wonderful. We like to use that a lot with complex chronic illness. One thing to take note of is that NAC, which is a precursor to glutathione, NAC and glutathione can be very, very helpful for some of these patients. For others, it can be troublesome because they have a mycotoxin picture, which can then disrupt some of the fungal, and they can have almost like a SIFA, which is small intestinal fungal overgrowth picture. And then they can be really, really, really sensitive to thiols, which are these sulfur compounds, which is what glutathione and NAC are. So some patients don't handle it well, but some it can make a real big difference. Lumbar kinase can be great for breaking up the biofilms. And biofilms can happen a lot with MCAS patients because of that genetic component. With the clotting cascades, what happens is a pathogen is in the body, and the genes of those people, when they see a pathogen, they're like, they want to wall it off or put it into, a sequestered space. And this is how biofilms can develop, particularly like for the example of the bladder. Inside the bladder, there are these little tiny, those are the interstitium, these little tiny spaces. And when the body's trying to release those mycotoxins, for example, and it comes out through the urinary system, they can get stuck into the wall of the bladder with this kind of plasminogen picture that some people have in a biofilm. And then the mast cells are like, hello, danger, get out, get out, get out. And then the bladder wall is totally irritated all the time. And then that's when you see frequent urination and a cystitis picture, even though there's no actual recognizable infection. Taurine can be used to support the bile, which then can also be helpful for getting rid of some of the toxic stuff that can be irritating the mast cells in the GI. And then we also want to look at making sure that micronutrients and sort of our whole iron picture, things like that, are well optimized. You can use hyperbaric oxygen, ozone. We can do IV ozone. We can also do high-dose vitamin C and immune-boosting IVs. We do this a lot in our clinic here. Those can be really, really helpful in terms of supporting a lot of this detoxification and immune support. We also have our plant friends, and one of the biggest ones is quercetin, and then some of these other little plant substances that are what keep the plant from being oxidized itself. So they actually really, really help in stabilizing the mast cells in your body from being too overreactive. I like liposomal forms for better absorption. And I like to work up to kind of what seems like a high dose, specifically for the quercetin. There are some really good quercetin blends out there as well. And sort of related to quercetin are some of these other things like the apigenin, luteolin, resveratrol. So our bioflavonoids are really going to be important in stabilizing mast cells. Also, ECGC and L-theanine are helpful in stabilizing mast cell as well. And perilla is an herb that's being used by a lot of clinicians. We also have our good old nettles, elderberry, curcumin, and I've listed that twice because it is so great in modulating and calming a lot of this inflammatory chemistry that we see. And then I really am a big fan of the mushrooms. They have a lot of great also anti-inflammatory properties and immunomodulating properties specifically. Now we've got natural substances. So one thing that I love to use with patients who are particularly experiencing some of these like GI or urinary symptoms is good old baking soda. And you can start with just a sprinkle before you eat. And then you can work your way up to maybe like half a teaspoon before eat, like 3 times a day before your meals. This really helps to stabilize overactive mast cells in the GI. There's a whole mechanism behind it, but it's very simple. And this is a very inexpensive and effective way that a lot of patients initially start to get things under control. And then we also have our binders. That's for our mycotoxin removal, toxin removal as well, especially in the gut. And then I really like to use homeopathy or nanomedicine. And these are substances that are very, 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 very nano doses. And they can really sort of gently shift the body into a place of calming down with the mast cells. And that's an individualized therapy based on each patient, but there are some sort of tried and true ones like histamine, for example, that is related to histamine. The vagus nerve and our parasympathetic strength and tone. We started out with this. This is great for when there is this constant sympathetic activation. ANS means autonomic nervous system. So this is what we see with people who have the POTS symptoms. So this is when, you go from sitting to standing, you feel like you're going to pass out or you might faint, and you also have the really fast heart rate, the heart palpitations. So working with the vagus nerve and making that parasympathetic, that rest and digest, like really strong, can actually kind of counteract what's going on with that ANS dysregulation. Vagal reset, like we did, there's a lot of different techniques for that. There's devices that you can get now that really help with getting the vagus nerve back online so that you can come into that rest and digest as opposed to the danger space. Regulated breathing. Another thing you can do is hum and sing. I tell patients to hum and sing in the car, in the shower, wherever they can, because that's going to activate your vagus nerve and bring you into that relaxed parasympathetic state. Biofeedback is also great for this. And for really sensitive patients who they can't even get into a breathwork thing, it's just too activating, too much. Any exercise is going to just have an inflammatory response. Listen to bird songs, get out into nature, whatever you can do, even if you're driving your car to a park and listening to the songs, because that's going to tell that limbic system, tell your body that things are safe, that you're in a safe space. If you can tolerate it, go to a park. You can get one of those good blankets. They have those, no tick blankets if you're concerned about like tick-borne illness and stuff like that. But just sit and lie, look at the clouds if the weather's good, and listen to the sounds of nature. And then we also have wonderful limbic system regulation. There's these these programs that you can get now. DNRS is the Annie Hopper one, and the Gupta program. Although Gupta can be a little activating for some MCAS patients. But there's a lot of things out there now that are focusing on the limbic system regulation. So calming down that danger and just saying everything is safe, everything's okay. As I've sort of already said, and I'm going to reiterate, if you are ultra sensitive and just, you're down to maybe 5, 10 foods, everything seems to trigger your symptoms, we can start low and slow with some of the things that I've mentioned. And then once things get a little bit more stable, we move on from there. So these are some other sort of, more naturopathic treatments that we can get into. But, just the importance of community and not isolating. There's a lot of online groups that you can join now for MCAS. Grounding has incredible efficacy. That's when you're going to literally take off your shoes and socks and get them on the earth, get them in the sand, get them in the grass. It regulates so many things in the body and really, really, really just gets everything back into balance. Yoga meditation, the EFT stuff can be great. Reiki and CST, especially for the really sensitive patients, just does a great job of rebalancing a lot of stuff and sort of moving a lot of somatic stuff that might be really held in the body and the nervous system and the connective tissue. Essential oils, that's back to that olfactory. So through your nose, that limbic connection, sometimes that can be really helpful for patients. If you're more sensitive, start with a really good quality single as opposed to one of the blends. There's psychedelic therapy and EMDR that people really love for kind of getting to the root of some of that trauma stuff. And then I just threw in here from the Eastern perspective how MCAS is a blood toxicity. Blood and liver go together in Eastern medicine, and they associate it with kind of like sort of like held on irritation, right? Like anger in the liver. So whatever you can do to kind of like get all that stress out. And then I love Ho'oponopono. So that's the I'm sorry, forgive me, thank you, I love you. And that's, you can do that with your body, with your mast cells. And I just wanted to end with this notion that complex chronic illness is always a journey. MCAS is a big and a long journey for a lot of patients. They've been to so many specialists. Nobody can find a darn thing wrong with them. Nobody knows what to do. But there is so much hope, and we can have so much gratitude right now because the knowledge is expanding, because our treatment options are expanding, because more practitioners are becoming literate in this. And I also want to finally end on that this can be seen as your gift to the world. The idea that you're the canary in the coal mine, right? We live in a world that is getting increasingly more and more and more full of things that can trigger our toxin barrel. And so MCAS people can be looked at as those who maybe are a little bit more sensitive to all of these things, but that in turn makes you do different things, talk to people about what's going on, and make different choices. So you're going to be buying different products. You're going to be saying, I can't take the fragrance in the dish soap or the laundry soap. And in turn, that ends up sending a message to others, to our policymakers. It's this sort of like the ripple effect, with the one drop in the pond. And so in that, these sentinel cells, which are overactivated in mast cell activation syndrome, you can then in turn be kind of like the sentinel to others in the world. So that's what I have. And let's see if there's any questions, Dr. Nicola.
Well, that was wonderful, Dr. Jules. Thank you so, so much. And we do have a couple of questions here in the chat, so we will look at those for sure. But that was a wonderful presentation, and that's great information for a lot of people. I want to just circle back to something you were talking to me about just yesterday or the day before, whenever it was, about when someone's got mast cell activation, like where to start might seem kind of overwhelming, but that it may be as simple as like going and getting an H1 blocker or an H2 blocker or something kind of like just, and again, I'm not saying that that I'm proposing this is like my favorite thing, but going to get an over the counter, something, or like an antihistamine. Can you speak to that a little bit more in terms of like your favorites? And you made a comment to me about sometimes even, if you can get it from your primary care, or if you're working with docs like us that deal with this stuff that can prescribe, sometimes even just starting with one prescription of an antihistamine or something, that's covered by your insurance, that, can you speak a little bit more to that in terms of like, what might be one simple thing that people could do other than, I'm all about the dietary modifications and the lifestyle and everything you said, I'm 100%. But I just thought it was really interesting, that perspective you presented of like, if you do this one thing and things improve, then you know that this is kind of the deal, the path that you're on, and then you can look more broadly.
Exactly. Well, I think you actually summed it up really, really well, Dr. Nicola. So, if a patient comes in and they have this sort of multisystemic presentation, and you can recognize, they've got the cystitis, they've got the IBS, they've got the POTS, and maybe there's a little bit of hypermobility. It's like, okay, we're suspecting already that this is MCAS, right? And so then at that point, it's suggesting, okay, hey, let's go. We can try an H1 or an H2. And these are things that are available at the drugstore. So your cetrizine, you can get that at any drugstore. Your H2, your famotidine. So trying one of them, and oftentimes patients might have to, they'll start with like diphenhydramine, which we think of, that's a Benadryl, for allergies, because they're having like allergy type symptoms, right? With respiratory or maybe hives. So they'll start with that, and maybe it's somewhat effective, but not really. Things aren't going away all the way. But then, they go and they take a cetrizine, and boom, everything calms down, no more hives, no more respiratory symptoms, and they're able to sleep. The insomnia is not there so much. So it's like, okay, this is a histamine blocker. So we know we've got a histamine picture, but that can just get our wings level enough so that we can then, not be living in this, constant state of misery, right, with our symptoms. And then from there, we can start to investigate what's at the root cause. And this is where we might be doing some of the things like our environmental or mycotoxin testing to see, what might be at play. Also looking into your history, what are the factors that might be here that could have been triggers.
Perfect. I love that. And, people say, oh, well, sometimes, people say, I don't really want to just put a Band-Aid on something, but I'm like, but it's not just a Band-Aid. It's like, let's try and give you some symptom relief.
Yes.
Get some confirmation that, the mast cell activation is going on, because
that's a data point.
Response to that,
yes,
as we're working on the underlying cause.
Yes.
So, yeah, I love that.
Yeah. I just see a comment. I love my PEA. Yes, that is a great supplement. For some people, that can be really, really wonderful, for especially calming down. I've seen it do really great things, for example, in long COVID patients. Yeah.
Yeah, and neuropathy. It's been great for that too. All right, what other questions do we have? Stephen Manning is asking, rifing, I'm assuming like for underlying pathogens and whatnot. Does that play, like, are you a fan of rifing, Dr. Jules?
Oh yeah, I love the rife. I love the frequency medicine stuff. I think they'll go with rife, go with a good, known, proven rife. I know there are some sort of like mini rife knockoffs and things that keep popping up on the market. Go with a good old tried and true rife. Those can make a real difference. Also with, a lot of the tick-borne illness people really, and chronic viral, they find that makes a real difference. Yeah.
And if you scroll up, Dr. Jules, there's a couple of other questions that.
Yeah, I see that, this comment about it is hard to sweat when you feel like your mast cells are activated by heat. A lot of people do really have a tough time with heat and cold, both of those. Sometimes like people will go in the cold ocean and they'll get triggered. Other times, people will be in someplace hot and they just, they go into the hives, the flushing, the GI symptoms. Yeah, same with the sun, exactly. So with something like this, yeah, I would say that, we'd have to look at the whole picture. It definitely here it sounds like, there's potentially a multi-system symptom picture that's there, which, is immediately I'm thinking, okay, this could be MCAS. But there could be other things at play. So this is where we really have to take the full history and really look at, what else might be going on. But this is also part of this root cause thing as well. Potentially there is a rheumatology picture here. There could be things that, whether it's a medication or something else that's triggering some of those responses. But let's say it is an MCAS picture, right? Then so this is like, for example, if somebody is experiencing those symptoms, the heat, when I go out in the sun, when my skin just gets touched, I get a huge hive. At that point, this is maybe somebody, if they can tolerate, an H1 or an H2 or a cromolyn or the ketotifen, The thing is, when you take one of those, it's going to stop those symptoms. So at least the symptoms aren't, there. So then you can go do the hotter shower or something like that to try to get some of the sweating going. So it's this idea of, finding whatever works. And sometimes this is a process. You try one, didn't do much. Try another, did something. You try a third one. That really worked for me. My symptoms have gone down. Once we are, calmed and stable, then we can start to get into some of these other treatments, that then, yes, can more address the root and underlying causes. So then eventually at some point we can then wean off whatever we are having to take as far as a medication to stabilize. I definitely recommend liposomal glutathione. There's one that we have in our dispensary here, that's wonderful. Some people do well with the flavored ones. Some people do well with just the plain. Let's see.
But Rhonda's asking about atrial flutter. And MCAS, is that a symptom that you see frequently? And it certainly can be associated.
Yeah, it definitely can. So the heart actually has mast cells all throughout it as well. And, in particular with, that a lot of times with some of these, electrical signaling things that can happen in the heart, it's sort of, you get that, well, there's the difference between like an AFib versus a flutter, but definitely, there's signaling that happens between the heart, the nervous system, the central nervous system, right? And there's all kinds of receptors throughout the body that help to determine, how fast and how hard the heart should be working. In MCAS, those signals get disrupted. So that's what I'm talking about with the autonomic nervous system disruption or dysregulation. What can happen is that these long pathways that are normally, running as they should, it's like the train gets derailed a little bit, or the train all of a sudden, the pedal's stuck, the pedal's on the floor, right? And so the car is going as fast as it possibly can. So yeah, and with the EDS and the POTS picture, with that connective tissue that we see with Ehlers-Danlos. So the connective tissue, again, mast cells are embedded with all the receptors that are involved with the connective tissue that have a lot to do with, whether something is stretching or being held into place. And so there's, again, this dysregulation with, what happens when my body's moving. And so that in turn, the signals are not going to the heart in the way that they normally would. And so what ends up happening is you get a palpitation, you can get a flutter, your heart maybe doesn't speed up as fast as it needs to, and then you have like a fainting or a syncopal episode. Biomats are great. Those patients find that those can be very, very helpful as well. Also for just, a lot of that nervous system stuff and calming down and just helping with, getting the body into an ideal space for a lot of that detoxification as well. What symptoms will I be experiencing if I need to stop taking NAC? For some people, this could be, sort of an upswing in their GI symptoms, so more like the IBS type stuff. They could also be experiencing headaches. A lot of times there's like a migraine or a brain fog kind of picture along with it. I'd say with any of these supplements, if things are not improving after a certain amount of time, do the experiment, try one thing, take it away for a few days or a week, and then try, you see, so then you can start to see the difference. The one blessing about being super hypersensitive, which happens a lot with MCAS, because you end up so sensitive to everything, the light, the sound, the smells, everything. You have a very, very good gauge of whether or not something is working or not. Because if something is really working, you'll know. And if it's really not working, you'll also know. But it's kind of like with an elimination diet, this idea like, okay, so I'm gonna, for the next 2 weeks, my dinner's just gonna be chicken, broccoli, and rice. I've got these 3 ingredients. So I tried chicken, broccoli, rice. I eat that, I feel bloated, I feel ill, I'm having IBS-like symptoms. Okay, next night, let's just do chicken and rice. I'm still feeling bloated, I'm still feeling ill. I don't, okay, well, we know it's not the broccoli. We thought that that might have been contributing, but no, it's not. The next night we have broccoli and chicken. Everything's calm, no issues whatsoever. So we know it's the rice. So going about things in sort of a systematic approach like that can be really, really helpful.
100% agree with that. And I also agree. And, Stephen made the comment too many people try everything at once and then you have no idea what's working and what's not working. But one of the things that, that we can utilize in medicine is looking at someone's response to a certain therapy or a dietary change or whatever, it, gives us clues. And in chronic complex illness, it is like a puzzle. We're putting the puzzle together.
Absolutely.
And so we can utilize response as clues, which is really helpful.
Yeah, and that's the point, and even with the diagnostic criteria, and this was decided upon a few years ago at this big conference where all the leading scientists, all the leading hematologists and immunologists got together and said, how can we make an international diagnostic criteria for this disease, right? And one of the criteria is, well, if they're responding to an H1 or an H2, for example, then we know that, that's a piece of data. And that actually becomes a piece of diagnostic criteria. So, but again, I just think reiterating, and I know I threw a lot of ideas out there, but the point was, and I really do, want to hammer this point, there are so many options. So there is treatment available. There are, combinations of tools. And it is, that's why it is a journey, because it's about finding which ones work right for you. And, again, I really do like to start low and slow, especially with the sensitive patients. However, again, getting the stabilization with just like one agent and then, trying other things, or, getting our testing, looking at, what we can actually find as far as markers that might give us a clue as to what sort of has gotten off balance, so that we can then address that while we're not in a symptomatic flare.
Yeah. And one of the products that we use and love at Restore is the Histaquel, right? The Research
Yeah.
Nutritionals. It's got
Yeah,
the quercetin, it's got the stinging nettles, it's got the perla. It's like there are some really lovely formulas that are sort of like natural ways to approach that can be helpful too.
Yeah, there
Dr.
are
Jules, I just want to thank you so much for sharing your wealth of knowledge and information. So yeah, like I said, I mean, Dr. Jules is with us now at Restore Medicine. She's consulting with people by telemedicine and locally in San Diego. If you are interested in setting up some time with her to go over mast cell activation and some of these other areas that she's really like very specialized in, just reach out to the clinic. So the practice is restoremedicine.com, no E on the end of restore, RESTOR medicine.com. You'll find our email and phone number through the website. And we're here to serve people with chronic complex illness. That's our jam, isn't it, Dr. Jules?
Yes, it sure is.
Sure is. All right, so we'll sign off. I will post a replay link. Appreciate you all for being with us, and yeah, have a blessed day and stay tuned for future webinars.
Thank you, Dr.
All right, good night,
Thank you
everybody.
all.
Take care. Good night.